Bob Dents has a related question in healthcare on home and community-based services. It'll go to Mr. Bass.
Thank you, Scott. AARP's #1 priority in New Hampshire is home and community-based care. Right now, New Hampshire spends about 80% of its Medicaid long-term care budget on institutional care service and nearly 20% on the less expensive home and community-based services. As both of you are aware, New Hampshire citizens overwhelmingly prefer home and community-based services. Would you support changing federal law and associated funding rules so that the ability to access home and community-based services is equal to the ability to access institutional care?
The answer is yes. And if I may amplify on this a bit, nobody wants institutional care over home care if you have a choice. And it's one of the problems that we face with Medicaid, in that the system is so rigid and so set and so controlled at the federal level, although the states run it, that there is very little or no latitude in trying to do things that really reflect the needs and interests of people that are in the program. I can remember a bipartisan task force consisting of a Republican and Democratic governor went to the Congress with bipartisan ideas for reforming Medicaid, and you should have heard the wailing on the Democratic side about how a Republican and a Democrat were doing what I consider to be practical measures to save money in the system while providing good services. The fact is that in the Obama health care bill, I don't think they could find a single dime of savings in Medicaid or anything to reform. It was total expansion, and the states ultimately will bear that cost.
Ms. Custer, 1 minute.
Mr. Dents, the answer is absolutely. This is an issue that is very near and dear to my heart, and I would sponsor the provision and work hard for it. I know from the experience that we had when my mother had Alzheimer's disease at the end of her life that the home care provided by the Concord Regional Visiting Nurse Association was critical to keep her in the home as long as we possibly could. They were especially helpful for the activities of daily living and just helping her to manage and helping my father to cope. You know, what I learned when we wrote the book on Alzheimer's and toured all across the state talking with families is that the biggest threat in a situation like Alzheimer's and dementia and dealing with seniors is actually to the caregiver's health. And so this is an epidemic that we all need to tackle. We need to give support to caregivers, and we need to give home care to keep people going as long as we can in a safe environment. And I completely believe that low-income people deserve this treatment as well.
Could I this will be the best rebuttal of the day. I want to salute your mother. I knew her. I campaigned with her, and once against her, as you well know. I'm sure you'll bring it up before the hour is up. We served together in the Senate. She was a wonderful person. I knew her when I was a child, and I think that the work that you did with her when she was sick was really quite extraordinary, and I just want to say that.
Thank you, Charlie. I appreciate it. She'd be